have a lot of questions to ask concerning fibroid and fertility, whether it can cause you not to conceive or affect your pregnancy. You don't need to panic. Just watch this video to the end and get the answers that you need. So what is this fibroid? It is a common type of non-cancerous or benign tumor that can grow in and on your uterus. And they are the most common benign tumors in the reproductive system of the female, occurring in 20 to 30% of women, and it is most common in women aged 30 to 50 years. What are the signs and symptoms of this fibroid? Although not all fibroids cause symptoms, but when they do, the symptoms can include heavy bleeding, especially submucosa, the one that happens at the inner lining of the uterus, pain during sexual intercourse, constipation, especially when it is pressing the rectum, abdominal distension when the fibroid is not too large, irregular cycles, menstrual clots, frequent urination when it's pressing on the urinary bladder. This can cause frequent urination. Even increased menstrual cramps, back pain, although all these symptoms depends on the size and location of the fibroid. How do you diagnose this fibroid? For proper diagnosis, it is advisable to consult a gynecologist that will perform a pelvic examination to check for the size, location, and shape of your uterus. The gynecologist will also refer you for an ultrasound scan, be it abdominal or transvaginal, to check for the size and location of the fibroid in order to make sure that it will not affect any fertility issue. And it's always advisable to meet your gynecologist as soon as possible once you notice that you have a fibroid, because early detection and treatment come with a better prognosis. Then let's talk about fibroid and conception. Some fibroids does not really affect conception. Everything depends on the size and location of the fibroid. And when you are pregnant and you have fibroid, it comes with a lot of issues, because during pregnancy, the level of estrogen and progesterone will be high, and this will also make the fibroid to grow, thereby competing with space that the baby will stay. That's why during pregnancy, coupled with fibroid, it is always advisable to be closer to your gynecologist so that your gynecologist will be monitoring you properly. So what are the treatments and management options for this fibroid? At times, some of them doesn't require any treatment. If they're not really posing any health challenge or fertility issues on you, please leave them like that. And before I can continue to explain the treatment options for this fibroid, I want to sound it as a note of warning. If you've been taking any concoction that you use to shrink fibroid, please desist from that. Please. Because you might think that it's really shrinking the fibroid or whatever. What are the contents of those concoctions? Are you thinking of your health issue, your fertility issues, what they can bring? Please avoid those concoctions to be on a safer side. Once you notice this fibroid, quickly meet with your gynecologist or your fertility specialist for consultation and a proper guide on how to follow it. Number one treatment option is dietary changes. Avoid anything with especially red meats and food that are high in calories. Eat more of fruits and vegetables, then green tea. These can slow the growth. Then medications like the gonadotropin releasing hormone agonists, such as the leuprolide acetate. This drug will eventually reduce the level of estrogen and progesterone in your system, and it will eventually stop menstruation and shrink the fibroids. We also have the gonadotropin releasing hormone antagonists, which example of them is the citrotide. This drug will shrink the fibroid, but they will also stop your body from producing luteinizing hormone and follicle stimulating hormone. We have the tranexamic acid. This is mainly for people that have heavy bleeding. This will stop the bleeding. Then the next option is the surgery, that is myomectomy, removal of the fibroid. Note that before myrectomy, you need to consult your fertility specialist for fertility baseline assessments to know the treatment option that is best for you, and the fertility advice will be given to you based on your results. But myrectomy depends on the size and location of the fibroid. For instance, when it comes to the submucosa, the one that occurs at the endometrium, inner lining of the uterus, hysteroscopy is usually advisable if it is very small in size, whereby the surgeon will use an instrument with a camera through the vagina, cervix to the uterus to go and locate the fibroid that is being treated. This type of fibroid usually affects fertility because the position is not really good for implantation, and once there's an implantation and the pregnancy progresses, it might lead to miscarriage. But after this procedure, under the effect of anesthesia, within some few hours after the procedure, the doctor will discharge you and he will advise you to start trying to get pregnant 1 month after the procedure. Then we have laparoscopy. This one is usually a smaller incision on the abdomen to remove the fibroids, especially when the sizes are small for subserosal and intramural. Then we have laparotomy. This is when a bigger incision is made on the abdomen, bring out the uterus and remove the bigger fibroids. Because once laparotomy is being done, it shows that the fibroids are big in size and their locations are not really okay. So this surgery will be done to remove them. And after this laparotomy, it is always advisable to wait for at least 3 to 6 months before trying to conceive, so that you leave time for those cuts to heal properly. We have hysterectomy. This is the only cure of fibroid, whereby the whole uterus is being removed, because fibroid can still regrow after all other treatment options, but with hysterectomy it will not. So for the whole uterus to be removed, it means that all other treatment options have been tried and nothing came out from it. Before your gynecologist will not advise you to do that, but the decision depends on you. And the fibroid might be causing a big threat to your life. Your gynecologist will also advise you to go for hysterectomy, but the final decision will depend on you. Also remember to go back to your fertility specialist after the myrectomy for follow-up related to fertility issues. In summary, having fibroid is not a death sentence. It occurs in many women and it cannot hinder you from getting pregnant. But it is only the ones that are too big or are located at strategic places would affect your chances of getting pregnant. But always speak with your gynecologist or fertility specialist when you are experiencing these issues, for them to give you a proper guide on which path to follow in order to avoid any mistake. Don't forget to subscribe to my channel and hit the notification bell for more updates.